Thank you everyone who are joining us for this timely and also hot topic today, which is health, wellness, and employee engagement. I'm here at TalentMap with Norm Baillie-David. I'm Kelly Rigoli, and I'm a marketing coordinator. And Norm, as you know, is Senior Vice President of Engagement. So before we get started, let me just cover our agenda today. So as you know, our topic, the business case of wellness will be one of the things we talk about, as well as does wellness increase employee engagement? And then another question is, so how do we get started? And then it'll be your turn to ask some questions. So just to tell you a little bit about TalentMap, we have been around for over 15 years. We have done an excess of 7,000 employee engagement surveys since we started. So we're looking at about 1 million plus employees surveyed since the beginning, and we generally run approximately 500 or more employee surveys on a yearly basis. Of course, our primary focus being employee engagement and measuring employee opinions. So we're going to show you some of our industries that we've worked with, some of our sample clients. We've worked anywhere from award programs to technology and engineering. We've had a long history with the nonprofit and association industry, as well as health sciences, financial services, and a number of other industries. That being said, I'm going to turn it over to Norm, and I'll be back at the end of the presentation to go over a couple notes just before signing off. Over to you, Norm.
Thank you very, very much, Kelly. Good morning or good afternoon, wherever in the country or continent you might be. My name is Norm Baillie-David. I'm Senior Vice President here at TalentMap. And what I want to take you through today over the next 35, 40 minutes or so is wellness. Not necessarily in terms of the wellness programs and program evaluation, but really the angle around employee engagement. And why we want to do this today, why I brought this topic really to bear is I've spent a lot of time presenting to leadership teams and to HR teams around the subject of employee engagement, as Kelly just explained, and many of you I see a lot of on the list know us for employee engagement, but we're also seeing a tie-in. We're seeing people saying, well, we need to get this wellness program started because it's going to improve employee engagement. And so I'm listening to all these arguments around that and really wanted to go back to the facts on this and to see, okay, the clients that we work with, the organizations that we work with, are they seeing, are they implementing wellness programs? Some are, and we'll tell you a little bit about that. But are they seeing that increase in employee engagement that is being promised by a lot of the vendors? So we're going to go into that a little bit and show you exactly what's going on, exactly what the engagement research is telling us. So that's really why I wanted to cover this off today. And so before I get started, I think what I'd like to do is really start by asking you folks, you know, where are we in terms of looking at employee wellness programs? I'm hearing a lot of buzz that, you know, this is the next thing to do. This is the thing for 2017. So what I'm going to do is I'm going to pull out a poll here. I'm going to ask you the question, and I'd like you to just, you should be able to see on your screen the question, do you currently have a wellness program in place? So if we can answer that, we'll see. And I'll give you another second or two because we have a lot of folks registered today. I'm thinking we're more than 125 and counting as people are still signing on. And so we'll give it another 5 seconds, up to about 30 seconds. We don't want to spend too much time on this. So looking at that, all right, let's, it looks like it's stabilized. So most of you here, two-thirds are saying you have a wellness program in place, which is excellent, because what I would really like to hear at the end and through your questions is, are you seeing the link between employee wellness and employee engagement programs? So let's ask you another question first. For those of you who answered no, are you considering it? Are you thinking about it? You know, what is, obviously the poll is a yes, no, but thinking in terms of the questions that are going to come later is, you know, where are you in your thoughts process or thought stage? So as we can see, I think just by your attendance here on the webinar today is a pretty good indication where most people sit on this. So looking at approximately the number of, so those of you who voted no, I'll give you 1 or 2 more seconds, and let's close that off. And 83% of you. So either you've got a program in place, or very, very close to getting one, or considering it. So hopefully this, what we're going to be talking about today, is going to help you in that decision-making process. So what I wanted to start with here is the business case, because obviously when we take this, getting a wellness program started is going to take convincing in terms of senior leadership. Most of you know this. You have your programs in place. But I think it bears repeating for those those few of you who are considering it, or even if you're not, maybe what the skeptics are. So I think the business case is really the easiest part of this whole endeavor, and that's usually the reverse. Usually when we want to put a new program in place, specifically in terms of people management or employee engagement, we're left having a very high, steep hill to climb in terms of convincing leadership. In the case of workplace health and wellness, this is not the case. There is a ton of research, very, very good research, that shows the cost benefit, that shows the clear business case about health and wellness and implementing a wellness program. And all we have to do is look at some of the things around the statistics around mental illnesses, the statistics in terms of the cost of smoking, the cost of diabetes, the cost of different other, the benefits of exercise. All of these, show return of investment, show improved productivity. There is no doubt about the return on investment in terms of a wellness program. That's not what we're talking about here today. I think that case is very, very clear. I mean, the profits of prevention, as we say, costs follow the health risks in both directions. I mean, the higher the risk, the higher the cost. Absenteeism, presenteeism, productivity, all of these are tied to specific health risks. And the return on investment really is around focusing on the people who are, unfortunately, I have to phrase it like this, but still healthy. And maintaining and preventative approach to future illness, to future health issues through a wellness program. Physical activity obviously being part of that, but not all of that. And interesting point here, and this is what you're going to hear from the vendors, that gains in employee engagement can be tied to wellness programs. And that's the question of today. That's the question that we want to ask. We want to show, okay, does the research really support that aspect? And because what we're hearing in the boardrooms and the leadership rooms, the executive rooms, is that let's do wellness because it's good. It's a good thing to do, of course. Let's do wellness because it will reduce costs, but let's do wellness because it improves employee engagement. That number 3 is going to be, that's the question that we really want to tie in today. So just, a few more statistics, and for those of you who still might be, building or need to reinforce that business case, medical charges, and costs obviously are lower when we're talking about the low-risk health groups, and what we're trying to do with a wellness program is keep people in those low-risk low-risk groups by promoting wellness, by promoting physical activity, by addressing and preventing disease before it actually happens. Studies on absenteeism clearly show, there's a decrease in absenteeism with the implementation of workplace health promotion, workplace wellness programs. So, I mean, I can go on all day in terms of looking at the business case, translating into more than, between $1 and $2 per dollar invested. That's a pretty good return. If I'm buying that stock, I'm going to be pretty happy. So, I mean, the business case is not hard to make at all. Even small increases in physical activity, walking, and we're going to talk about walking meetings, standing desks, and all of these things in a few minutes in terms of the actual implementation of wellness programs. But the key question for us today is the link between wellness and employee engagement. So let's look at what's out there. Let's look at what the research is saying. Now, the first thing is, and this is really where we're seeing the demand for it, is employees want it. There's no question in all of the surveys done, in all the surveys that we do, in all of the interviews and focus groups that we conduct, there is no question that employees are asking for this. It's also showing that in our onboarding studies that there are, it is a key recruiting tool. If company A can offer a wellness program and company B is not offering one yet, everything else being equal, people are gravitating towards the wellness programs, the health, where companies, organizations are taking care of their employees, are investing in this aspect. So there is demand. I mean, employees want it for sure. And I've just got some statistics in terms of survey statistics here. This one's done by Transamerica Center. There's ample Canadian research as well. I mean, all you have to do is Google this, and the studies. There's more studies than you can read in a week. That there's no lack of information around this. The demand is certainly there. Now let's look at something a little bit more concrete. So we dove into some of the clients that TalentMap deals with and who have recently implemented health and wellness programs. And we're looking at the research and what their surveys are telling us. Now, we don't necessarily measure the satisfaction towards the wellness program per se. We're conducting this in the course of an employee engagement survey. And so the closest that we come here is when we're looking at wellness, we're looking at the satisfaction or the view of non-cash rewards, perks. And of course, in that comes a number of things, but the fitness center, the staff clubs, and in this particular client's case, they had implemented a wellness program in the 12 months prior to the survey being taken, so it was really top of mind. And the comments, which I'll show you a few of them in a second, really show that the thinking around the answers to this question really revolved around the wellness program. So let me sort of back up and explain what's going on in the slide to show you the impact of the wellness program in terms of this particular dimension. So typically we ask in an engagement survey, we ask about compensation. And so the questions that you can see there on your screen, am I satisfied with my cash or base compensation, benefits, non-cash rewards, where we would obviously see the impact of the wellness program, as well as the previous question, the benefits. So it ties into that as well. And the company paying, well, similar to other organizations in the industry. You can see the green represents people who agree with the statements, the neutral represents neither agree nor disagree, and the orange represents the people who are actually disagreeing or even strongly disagreeing with those statements. And overall, in terms of compensation, you can see there's a relative high level of dissatisfaction. Not far off from the average if you look at the benchmark on the right-hand top corner. But where you see greater levels of satisfaction are on those two attitudes that link to the wellness program. So, and in particular, we see in terms of the benefits, but benefits go way beyond just the wellness. So we can't just interpret that as equating to a satisfaction with the wellness program. But then when we look at this question around non-cash rewards, it really is different in terms of the higher level of favorability towards this particular aspect of compensation, which includes the wellness program. So it's not definitive necessarily. It's not, we didn't ask, are you satisfied with the wellness program? But when we looked at the comments, it's very, very clear that people are answering favorably because of the wellness program, and I'll show you that in a second. And we can also see substantial increases compared to previous surveys. So this organization does this every 3 years. This survey came from late last year. So, there was a substantial increase in that. And also, we're seeing that, now this is substantially over the benchmark. It's better than average. So we are concluding when we look at the comments following and the many, many comments referring to the wellness program, that the wellness program is not only well received, but it's improving overall perception in terms of the compensation and benefit dimension. So we can say that. And of course, this is just one example to illustrate to you some of the impacts that we're seeing in our research. But I can clearly say that when we take this and we generalize it to other organizations that are implementing or have implemented their wellness programs, that we're seeing very, very similar results. So what are people actually saying here? Well, and this is where it really is talking specifically about the wellness program. Now, it's interesting, we didn't ask around, this question isn't in response to the wellness program per se, it's in response to how can we improve compensation, how can we improve work-life balance, and how can we improve work environment, those three things. And everybody is talking about, these are the comments that are coming out, so we do see the wellness program being top of mind. I think the introduction of 2 personal days and the wellness account are wonderful additions to the benefits of working here. It makes me feel appreciated, and I think that's really the key, is what is the emotional return on investment in terms of, you know, how people are feeling as a result. Because the physical part of the wellness is really a cost measure. It really is the organization investing in people to keep them healthy so that they can be more productive. It sounds a little bit mercantile, but ultimately that's what the business case says. But of course, we also want people to like it, and we want people to appreciate the organization as a result. And the theory being that contributes to employee engagement. So yes, in terms of this particular person and many others like that person, the wellness program is making people feel appreciated. The second comment down here, my work-life balance is not just the responsibility of the company. I take it upon myself to ensure I continue to work better myself in this respect. The new wellness plan is wonderful, and again, I appreciate it. But now I think I can read you reams and reams of comments that are saying how much the wellness programs are appreciated, liked, taken advantage of, etc. But we're also seeing a little bit of a counter view, and I think this is where I'm introducing the element of doubt that I've been referring to or inferring in terms of that link to engagement. So let's read the first one here. Sometimes the messages we get about wellness seem contradictory. While they say they want us to be healthy and well, which the programs do evidence, sometimes it's hard to find the time during the day to act on wellness initiatives and not worry about missing deadlines or meetings with business partners. Second quote here, the bottom right. In general, the company does a good job of helping maintain work-life balance. Fitness center, wellness plan, mental health training are all excellent resources. My only concern is the new role I have is very challenging. Feeling overloaded all the time, calendar being full. You can read the rest of the quote. I could easily work 50-hour weeks. And what we're also seeing here, and I think this is a little bit of you know, what is influencing, and it's going to explain the results in terms of engagement that I'm going to talk about a little bit more, is implementing the wellness program in and of itself has to be part of a greater people strategy as opposed to, okay, let's do wellness and wellness will increase engagement. Because other things need to be managed as well. And other things are having counter views in terms of how the wellness programs are A, effective, and B, being interpreted. So in many organizations that we've dealt with, one of the, you know, the antidotes to issues around work-life balance is, okay, well, let's implement we have a work-life balance issue, let's implement a wellness program to address that. Yet, very little is done in terms of addressing the root causes of the work-life balance issue, which tend to be cultural. And I've got a whole other webinar on that piece. I'm not going to get into the details. But the details are we're providing opportunities for people to stay healthy, but at the same time not fixing the root causes of why people are stressed in the first place. And so you do get that contradictory message that's coming across. And of course, when you do have those contradictory messages, your impact on engagement may be, not necessarily saying it is yet, but it may be diluted. Now, the research is showing that there are some links between engagement and wellness. But I'm a skeptic with this kind of stuff, because the first thing I'm going to be looking at is who's the sponsor of the research. And if those of you who've dealt with vendors in terms of health and wellness programs, I'm sure I've been confronted with a lot of the research that ultimately is sponsored by the vendors themselves. It's very much like the pharmaceutical industry. So we have to be very, very careful in terms of what the research is actually telling us. So it's not hard to infer a link, like I've already done, between wellness, happy employees, ergo there's improved engagement. But as I think everybody on this webinar knows, in terms of who, at least those of you who've dealt with TalentMap before, knows our position in terms of happiness does not necessarily equate into engagement. Happiness alone is not going to make people or want to go the extra mile necessarily. There are other elements, other dimensions, other drivers of engagement involved that have very little to do with happiness. Things like professional growth, the vision of the organization. Those are going to contribute more to engagement. But let's look at the research here. So the wellness effect, the impact of workplace. This particular study is cited extensively. So if you just Google that title, you'll be able to go get the study. And it's pretty, there's some findings that 67 employees said participation in wellness programs increased their engagement in their employer's mission and goals. 91% participating in wellness programs have improved their fitness. So the program's working, their fitness is improving. Employees agree, 46 and 51. The biggest obstacle in wellness programs, lack of time. Okay, so there you go. It's back to the whole link with work-life balance. 44% of employer responses, stress management programs would be the single most effective way. So it's again tied to that work-life balance. And only 14% of employees regularly participate in stress management. But 71% are saying wellness programs are having at least a moderate impact in lowering stress. So those people who are participating are getting some benefit. But I take issue a little bit with the first one. Some 67% of employees said participation in wellness increased their engagement in employers' mission and goals. And the reason I take issue with it, and you should be asking yourselves the same question in your own, when you're interpreting your own engagement surveys, is individuals essentially, if we ask them straight out in terms of are you engaged or are you not engaged, inevitably there's a very, very strong participatory and desirability bias to say, yes, I'm engaged. And so this issue here, this question has to be taken with a little bit of a grain of salt and said, yeah, okay, because people they like the wellness programs, there's demand. And of course, they also know that one of the objectives may be increasing engagement. So there's a strong predisposition to say, yeah, that's doing that because I like the wellness program, so I'm going to say it increases my engagement. But engagement is actually a result of a series of other attitudes, like pride in the organization, like being inspired to do one's best work, by getting a sense of personal accomplishment. And we don't know yet whether or not there's a link with participation in wellness programs and those fundamental engagement attitudes. I'm not discounting this, I'm questioning it. So other research that we've done is what's that showing? It's showing that those clients, those organizations that we have dealt with, in fact, yes, the engagement when we ask those engagement questions is higher. So there is a link there. There's a link between the wellness program in a client organization and everything else being equal in an organization where there is no wellness program, engagement tends to be higher. But they're also rating things like work environment, compensation, the non-cash rewards or perks, like I showed you in the example. Those are being rated more highly. And I think intuitively, and also shown in responses to the questions, remember, those of you who have heard our head, heart, hands model and have heard me in presentations before, understand that really the foundation of employee engagement is the organization showing that it cares. And intuitively, a wellness program does that. So yes, it will, we would think, contribute to engagement. But here's the rub, and this is what I've been alluding to since the beginning of the presentation this morning. Engagement is not, we're not seeing a link between engagement and wellness programs solely due to the improvement or the introduction of that wellness program. It's much more complex than that. And this is what's confounding and even disappointing some of our client organizations, because the investment involved, even though the return on investment is very, very clear, engagement is not necessarily improving solely due to that introduction. The expected improvements in employee engagement are not materializing with the introduction of the wellness programs. So why not? Why is that not happening after everything we've been talking about? Why are we seeing an improvement or an increase in engagement when we introduce a wellness program? And the reason for that is when we look at what drives engagement in the first place and what doesn't drive engagement or don't usually drive engagement. What drives engagement in many, many organizations that we deal with? I alluded to them before. Professional growth and development drives engagement. So if we see career opportunity, we're learning, we're growing, we're making a difference, we tend to be more engaged than the reverse. Organizational vision drives engagement. Senior leadership drives engagement. Innovation drives engagement in most or a great many organizations. But dimensions which would include a wellness program, like the work environment, like safety, like compensation as we saw before, work-life balance as well, those do not tend to be drivers of engagement. They tend to be taken for granted, especially in the case of work environment, safety. I'll leave compensation out of this, but work-life balance, where taken for granted might be the wrong phrase or turn of phrase. We don't see a link between satisfaction on those dimensions and high levels of engagement. So it's not because we have good benefits. It's not because we have a safe work environment. It's not because we have good work-life balance that we're necessarily engaged. And engaged being pride, optimism, inspiration. Would we recommend the organization to someone who's coming in? Do we contribute to the long-term future of the organization? Those things drive are the attitudes which are engaged. And the wellness program in and of itself isn't part of that. So it's a nice to have, absolutely. Not only is it nice to have, it's almost a necessity in terms of the cost benefit. But wellness alone, we're not seeing wellness equals improvement in engagement. And now some of your experiences might differ. They might differ. Maybe you have seen that, but we're not seeing it. So I think what we want to do is we want to go into this eyes wide open. Just on the screen you see a little bit more data in terms of some of the evaluation work that's been done around the impact of wellness initiatives on the organization. And you can see here, the jury really is still out. From no impact, we're seeing, there is some impact. There's some major impact on some of these things. The organization's image, the reputation, job satisfaction. But really where we're seeing the bigger impact and, morale, job sat, but job sat is not engagement, as you well know. And of course, we're seeing, a large, almost 50% here that we're saying little or no impact. So yes, there are benefits. Yes, the cost benefit is there. But are we seeing that clear cause effect in terms of employee engagement? Not necessarily. In other words, at least from our perspective, we see with the jury still out in regard to wellness alone showing direct improvement in employee engagement. Now, those of you, the large majority of you, already have those wellness programs in place, and are you sort of, does that mean we're questioning whether or not, is this buyer's remorse? Absolutely not. Absolutely not. Because wellness is still the right thing to do. Implementing the wellness program is still the appropriate strategy. It's still the right thing to do. All that we're saying here is don't necessarily expect the employee engagement payoff. Expect it and do it for other reasons. Of course, showing you care is never a bad thing in the employee engagement context. But expecting employee engagement to improve with the introduction of a wellness program, and you may be disappointed. The other thing is people practices, people policies, people programs, HR is not only about employee engagement. As much as, sitting here at TalentMap where employee engagement is all we do, we might preach otherwise. But, health, wellness, mental health, productivity, absenteeism, retention are all influenced by things other than engagement. Yes, of course, employee engagement is important. Nobody's saying that it's not. But we don't necessarily have to look at everything through the employee engagement lens before we believe it's the right thing to do. And of course, I come back to the business case. I mean, this is a good return on investment. It pays off. It's a good thing to do for your employees, and it's going to pay off in terms of productivity, in terms of absenteeism, in terms of retention, in terms of all those things. And ultimately, there will be some impact on engagement. It's going to contribute to engagement, just like work environment, safety culture, compensation, all contribute to engagement in a minor way, but are not necessarily causing higher engagement or lower engagement. They're not the key engagement drivers. And of course, there are other benefits like recruiting, onboarding, on all those things that we didn't necessarily do. So I just wanted to spend the last few minutes in terms of, for those of you, I guess this is old hat for most of you, but for those of you who are considering still, or even those of you who are not, so what do you do to get started? I want to be very clear, unequivocal in the statement that we at TalentMap, and I specifically, are very, very pro wellness. But not necessarily, don't expect the engagement payoff. So what does a health and wellness program consist of? I mean, there are other vendors, there are other organizations that you'll learn about much more than here, but I just want to sort of push this off in terms of getting us the right foot, and especially for those of you who haven't necessarily done this, there's 4 spheres. Work environment, we talked about that, so computer equipment, facilities, workload. Stand-up desks, meeting rooms, walking meetings, those types of things. I'm talking to you here from a stand-up desk. I love it, and it's great. But that's I'm not the scientific evidence, but I'm certainly the anecdotal contributor to this. So just for the fun of it, let me put my webcam back on and show you. So let's see if you can see my stand-up desk. Not very well. There we go. But that's where I'm talking to you from here today, my own stand-up desk. And I can say if there's one thing that's contributed to my own feeling better, health and wellness, it's certainly been this. So I more than endorse the couple of $100 that is necessary. But it has to be, I think, coming back to the elements of a health and wellness program, it has to be put in balance. I think this is where a lot of organizations are falling short, in that they're putting in the wellness program, but they're not making the adjustment necessarily to the culture that needs to be in place to promote wellness, and that's work-life balance, flexible work schedules, leave for family obligations. We saw a couple of examples of those quotes, in those quotes that I showed you before. Management practices have to change, internal communications, team activities, onboarding, and lifestyle. I talked about walking meetings, the gym culture. What's the gym culture? The gym culture is the acceptance that, hey, I'm going to be spending an hour and a half during my work day at the gym. And it's not necessarily, it's a meeting like any other important meeting. And that's a big leap for a lot of people, a lot of managers, a lot of organizations. So the wellness program in and of itself is helpful, but if it's not balanced with the cultural changes and norms, it's not going to achieve its full effect. So in terms of implementation, on this, you've got this nice flow chart here. In terms of which really provides a good synopsis in terms of how to get started. It's pretty obvious in terms of what has to happen. I think 3/4 of you know this already, so I won't spend a lot of time on it. But senior management is key. Obtain that commitment. The business case is there, very easy to build. Form that health and wellness committee. You also have to find out data. You need status of the situation. You might have to do a lot. You might need to do some medical testing. You might need to send your folks out for tests, and then figure out, just like any other health and wellness program, you need to do the diagnosis. That's where my own area of competence is lacking, so I'm not going to try and steer you in that direction. But collecting the appropriate data in terms of what should we be focusing on in terms of wellness is obviously key. And then you're going to prepare your plan, get it up and running, evaluate, and make changes in need, and measure, measure, measure. That's really the key. We need to be able to measure, and of course that includes including a question or two in terms of the wellness program, specifically in your employee engagement survey or questionnaire. So on that note, I'm just going to turn this back over to Kelly, who's going to take you through some of the places that you'll be able to see TalentMap in the next few weeks and months. And while Kelly is doing that, I'm going to take a quick look at some of the questions that have begun to appear. So I'll let you go ahead, Kelly.
Okay, great. Thank you, Norm. So some of the upcoming TalentMap learning sessions we have coming up, for example, February 16th, we're going to be going to an HRPA chapter meeting in Algoma for a lunch and learn. And Sean Fitzpatrick, our president of TalentMap, is going to be speaking on, so what is employee engagement and how to achieve it? Next up on February 21st, we have the Conference Board of Canada is having a conference here in Ottawa that's on the HR public sector. So Sean's also going to be talking there on understanding, measuring, and improving employee engagement and culture in the public service. Next up, we're going to have in February, we're going to have a live webinar, another one. And this one's going to specialize on a specific topic in an industry to do with financial services. So we're going to talk about how engagement affects customer experience in financial service, which obviously directly relates to customer satisfaction, which could definitely affect engagement and also productivity. So it's a very hot topic as well. Then we have on March 14th, we have an HRPA chapter in Halton meeting that's happening, and we'll be speaking on employee survey feedback from data to action to results. And then we're going to be traveling down to New York, to Albany, New York, for an annual conference, the Capital Region Human Resource Association. They have a one-day conference and also a marketplace. It's going to be about from employee engagement to employee experience. So Sean will also be speaking at that event, and that's on March 23rd. So I'll pass it back to Norm, and if you'd like to cover some questions.
Absolutely, and the questions are rolling in. Thank you very much, Kelly. So the first question here is, the study said 67% say wellness program increased engagement. How can that data point be entirely disregarded? We're not disregarding it, but what we are is interpreting it with a little bit of a grain of salt, and I'll tell you why. Because in that data point is asking people directly, that question asks people directly, did your level of engagement improve? And we have an issue, or I have an issue as a researcher in terms of how that question is phrased. So if you ask somebody whether or not their engagement is up or is it down, essentially an engagement is an aggregation of a number of different attitudes. And in and of itself, people are pretty good at assessing whether or not they're feeling positively or negatively. That's not what I have the issue with. What I have the issue with is in terms of the bias that's inherent in that question. So we have to be very, very careful when asking people in an organization to assess the way they feel towards different linkages, because there's a predisposition or a bias to respond favorably. It's called, it's called a social desirability bias. So we're not discounting. I don't discount that at all. I'm just interpreting that with a little bit of skepticism, shall we say? To say and people want the employee wellness program. So if that's achieving the outcome that the organization wants to achieve, I'm going to be predisposed to say, yeah, it is, because I'm thinking I want it. So I don't want to say anything that's going to disrupt it. And so that's why we question that. So I'm hoping that I wasn't too dismissive, but that's the logic behind why I'm a little bit more skeptical. And we're a little bit more skeptical when we're looking at that data point. The next question, can you provide a list of impactful wellness initiatives that are easy and quick to implement? And the thing I can point to the most is the wellness account. So in the organizations that have done this pretty quickly and haven't had time necessarily to go out and get a vendor to implement a full-blown wellness program, which includes fitness center, health checks, dietary programs, and all. So they've done, as they're implementing and they're going about a more widespread implementation of wellness, they've basically said, here's an X $100 over the course of the year that you can spend in whether it's a gym membership or whether it's a number of different things, very, very similar to certain benefits. So wellness accounts are very, very favorably viewed, and it also provides a lot of discretion to the individual employee to spend more or less as they see fit within, of course, the parameters of that particular program. Gym memberships tend to be another very, very common one, but really the things that show the greatest contribution to organizational wellness are things that are done on the culture side. So standing meetings, for example, is a great one. Standing walking meetings, standing desks, I showed you mine. Not implementing widespread, but for those who want them. Not only the ones that need the doctor's note to say that they have a bad back, but recognizing that this is a contribution to wellness. Meeting diets. One of our organizations that is involved in it's a major Canadian not-for-profit. They have a lot of meetings. They have a lot of national meetings, and the wellness program is implemented there through the catering, through access to or time allotted during their meetings for physical fitness. Those types of things. So that shows not just the fact that, okay, we're going to go out and buy a benefits program and call it wellness. We're actually taking this seriously as a management team, and we're going to promote that as a management team. So there's just a couple of ideas, a couple of things that we're seeing. That also, I think, answers the question or addresses the question: what wellness initiatives are becoming new trends? That's certainly the dietary trend is really, really, really key. And then let's see. How do you manage introducing wellness sessions and employee time, workload, and availability issue? That is the thorny question. That is the thorny question. And that really takes a culture shift with the leadership team, beginning at the top. Beginning at the top. And the best way to do this is to get the leadership team to walk the talk. And get the leadership team to say, I'm not doing a meeting from 12 to 1:30. I'll be at the gym. Or we can do this meeting from 3 to 4, but we're going to do it as a walking meeting or a standing meeting. And that reverberates throughout the organization. And that shows the priority. But it takes, obviously, the leadership has to buy into this in a very personal way. So it's not going to happen to everybody. But that's the thing that we're seeing that works the best and really differentiates those organizations that are making big strides on this versus those that are paying a little bit more lip service. What are those different elements? Part of wellness accounts. That depends on the organization, and I can't really discuss details around that. Those are very, very easily accessible in terms of looking at different vendors and different benefits providers to see what they can include and what they don't include. Does the research link wellness programs to preventing absenteeism? Yes. And general health of employees? Absolutely. Yes, it does. The research is unequivocal, very, very clear on this. There are direct empirical links between absenteeism and wellness programs, and I referred to that in an earlier slide. So when we post this on our internet site, which you'll have available in a few days, I think it's 5 business days, Kelly said, you'll be able to see that link, and then you'll be able to see that research as well. But any Google search, and you'll be able to find that as well. The second part of that question: is this considered the profit of prevention? Partially. The profit of prevention is really the return on investment of investing in wellness programs to keep the healthy healthy. The aim of health and wellness is really prevention, and so the lowest risk groups tend to benefit the most from the wellness programs, obviously, and that's what we call the profit of prevention. Really focusing the health and wellness, focusing on preventing disease and health issues in the first place. Next question here, our challenge is to get wellness initiatives that are accessible throughout the country for head office and remote employees. Any suggestions? I think really I would suggest something that's very, very flexible in terms of that, because of obviously there's going to be availability issues in terms of the types of things that are available. So the wellness account is probably the most flexible, but the culture and the culture around work-life balance, wellness, and physical activity, that's something that's not geographic. That's something that can be spread around. And that's also something that what we can do is we can, when we have employees in different locations, this is where we can, through the Health and Wellness Committee, we can actually, and I've seen this done, we can actually promote different approaches to wellness based on geographic location. So just an example popping up in the top of my head is on the West Coast, for example, the polar bear swim and the sauna, and linking those, those activities to how they do wellness on Vancouver Island, for example, and then they promote that. That's just a one-time, one event, but you can see in certain areas of the country, they can have very unique approaches to promoting health, to promoting wellness. So that's, I mean, that was just one that I rhymed off the top of my head, but I think what's really interesting in that particular perspective or that particular example is you have an opportunity to provide people around the country with their own, and get them to take the initiative and show others what they can do in their own particular region to promote wellness that might be unique to that region. And that can be dietary as well. That doesn't have to necessarily mean physical activity. And of course, culture. It's all about work-life balance culture, wellness culture, starts from the top. That's really what is going to be the key to success in the whole thing. The wellness program in and of itself will augment that success, but it will come up to, there'll be roadblocks and stumbling blocks if we can't reconcile with the wellness issue with the cultural issues that surround work-life balance. So on that note, folks, I think we've addressed most, if not all, of your questions. If you do have more questions, I would encourage you just to write any one of us here that you see on the slide, particularly myself, or depending on where you are in the country, Monica in the West, Louis in southwestern Ontario in the GTA, myself basically for national. So on that note, got a couple of other quick ones. So actually a suggestion, so I'm going to throw that in. So it's just a suggestion for remote location wellness programs. You can introduce Tabata exercise programs, I hope I pronounced that right, that require no equipment and can be done in about yoga mats worth of space. They work very well for our participants, so thank you for that suggestion. So on that note, and with that suggestion in hand, I'd like to thank you all for your participation. It was a great turnout today. I'm hoping I've addressed the issues around the links and the questions that we have between linking and employee wellness and employee engagement. Wellness is good. We have no issues, no bones about it, but does it improve in and of itself, improve employee engagement? Jury's out. Hopefully it is for you. Thank you very much. Have a wonderful day, everybody.